I'm the pre-optometry representative for the Pre-Armenian Society, Armenian Health oh my God, sorry. I haven't had a meeting in a little while, so I'm kind of nervous, sorry. Yeah, I'm a third year at California State University of Northridge, and I'm planning to take a gap year after I graduate next year to study for the OAT. So if anyone needs help or questions from me, you guys can always text me. But during this meeting, if anyone has any questions for Dr. Honarchian, you can just drop it in the chat box, or you can send it to me and I can ask her. But yeah, Dr. Honarchian, you can take over.
So you guys are mainly, all of your pre-health students, I'm guessing, right? So just a bit of intro from me. I went to UC San Diego, graduated with a human biology major. Sorry, let me close this. Okay. And then after that, after graduating, I needed a break from school. I was very burnt out. So I took a year and a half off and just volunteered a bit. Ended up working in a ophthalmology office. And then at the same time, I was studying for my OAT, which is the entrance exam for optometry schools. And then I volunteered in India for it was an underserved community. We went and helped out with eye exams and surgeries. And then from there, I started applying to optometry school. And then after that year and a half gap, I started optometry school. And then I graduated from Western U at the top of my class in 2017. And I've been working since. So yeah, so any questions you guys have, if you're confused, you don't know what route to go, feel free to.
I had a question. So I was just wondering how, during your undergrad, how did you prepare for optometry school? Like, what processes did you go through?
So I knew I wanted to be in healthcare. I just didn't know exactly what field I wanted to be in. So it wasn't actually until my last year in undergrad where I started going to different like pre-health clubs. So and I went into the optometry one, and then I started liking that. So I ended up getting an internship with like an optometrist in the area. And then from there, the guy loved his job so much, he made me really like it. So after that, I that year and a half gap I took, I really went to like, if I volunteered at hospitals, dental, I looked into like pharmacy, anything you can think of, medical school. And from there, I kind of decided that optometry was the route for me. So it's definitely test out like all of the different options you have before deciding. You want to see how the everyday life is for that career, because you're going to be doing it for the rest of your life. If you don't like it, it's not going to be fun.
We have a couple of questions in the chat. So I see Andrea said, how did you choose the school you went to?
For undergrad or optometry?
I'm guessing for optometry.
So I live in LA. All of my friends, family, everyone's here. So my goal was just to get into something that was close to home. I wanted to not miss out on my life here. If you're someone who wants to like get the experience of moving away and like traveling and stuff, obviously pick something farther. But my biggest advice is go visit the school and visit the area, and you know yourself better. If you're someone who's comfortable being alone, like on your own, then you're obviously going to be okay moving. If you're not someone if you're someone who doesn't like to do that a lot, you like having the support of like your friends, your family, then choose something closer. Expense was another factor. Obviously, the closer you are to home, you're gonna have less of an expense. I went to Western U, which is in Pomona. I still ended up moving out my second and third year. The first year, I ended up driving back and forth, and it just became too much. It was about a 45-minute drive, but that was time I could have been sleeping, I could have been studying, not stuck in traffic or something. So that's why second and third year, the courses got so heavy that I felt more comfortable moving over there. But like on the weekends, if I would have things to do with family and stuff, it would be easy for me to kind of balance that. So that's kind of why I chose Western.
Okay, thank you. Another question was, do you recommend people do residency, or you feel that going straight to work was more than enough?
So it's different depending on what field you go into. For optometry, if you're not planning on teaching, like at a school, becoming a professor, or if you're not planning on doing vision therapy, I'm not sure how familiar you guys are, but there's different kind of fields of optometry. So vision therapy is kind of a lot more focus based. So if you're not doing those two, you really don't need residency. Um, when they're hiring you, honestly, no one even looks at that. They just need someone to fill the position. So it's, in my opinion, it's kind of like a waste of a year. You could be making a lot more money. By the end of your fourth year, you're gonna have so much experience that it's not like you're not gonna have experience where you're scared you need another whole year to work. So you're gonna be definitely ready to start working.
Perfect. Thank you. Andrea, do you have a follow-up question to that question, or if not, I'm just gonna continue to the next question. Do you have any advice for shadowing? Like, what should you ask, or what should you do
For
to
sure.
get? Yeah.
So it's a little tricky right now just because of COVID. A lot of places aren't accepting like students to go. I actually, like in the past, I would let students come and shadow me for like a few hours. So as soon as that opens up, feel free to reach out to me. You guys can even come shadow me for a few hours. If you are interested in that, definitely send me a message now. So as soon as like my workplace is okay with it, I'll message you guys back. So as far as shadowing goes, try to see the different types of optometry offices there are. It's very different. So there's private practices where you own your own business. Go look into that, see how you like that. There's ophthalmology offices where it's a lot more fast paced, and it's a lot more seeing like eye disease. So you're going to see a lot of eye disease and you're going to be correcting their vision. So it's kind of both, but you have to be very quick at seeing patients. And then there is more contact lens focused practices. So specialty contact lenses. There's pediatric ones, so look into that. What was the question exactly?
It was like, how would you like any advice for shadowing? Like, how could you ask for shadowing, or?
So honestly, doctors love it when people want to go see how their job is. So don't be embarrassed to go. Just go into your neighborhood, honestly, dress a bit professionally, and then go into their office and ask to speak to the doctor and say that you're a student, you want to shadow, even if it's for a few hours for that day or a different day, whatever day that works for them. And most of the time they get so happy that students are interested and want to learn. So don't be embarrassed at all to go ask.
Thank you. Next question is, where is your ideal work environment in optometry? Do you corporate, group practices, private solo practice, MD, OD practice? Just like in general for you.
So my experience when I graduated, so before graduating, I was all about disease. During my 4th year of school, I was like, I love eye disease. I want to be in an environment where it's all eye disease. And then after graduating, I started taking up random jobs in the area. So that's what I suggest doing before committing to a job. Ask the place, because there's a lot of jobs that get posted online. So you can easily just contact the doctor and then go fill in for that day. So I ended up doing that in a few different types of offices and settings. And from that, you can easily tell if that's what you're gonna like doing or not, because it's very different in every office. And then I ended up working in a private practice the first year. It was in Lancaster, I believe. So it was a bit of a drive for me, but I liked the like office environment of it. And then after that, by chance, there was a job listing very close to home for me. And that was so important, not having to commute. So now I'm actually inside the Lens Crafters in the Glendale Galleria, and it literally takes me like less than 5 minutes to get to work and back. So that was a big factor and decision for me. Before committing to that job, I was going to take a private practice job, but again, it was a bit farther for me, and that was kind of the factor for me. So inside of Lens Crafters, it's a bit of fast paced, but what I like about it, all of the technology is high tech. So you're not working with old tools. So that's very important to me. In Western, what I also liked about our school was they show you how to use like the 4 opters that are the old method, the one where we do the 1 or 2. And then there's the automated ones. So they have both. You get to practice with both. So when you graduate and you get a job, you already know how to use both tools. Some of the older schools don't have all of the automated stuff. So that's another factor why I actually liked Western school. Yeah, that's
if you wanted to open up your own practice in the future, is that something that they discuss about in school, about like the steps to take to open up your own?
So unfortunately, this is something I wish schools taught, but they don't teach you anything about business or how to like open something up. All of that you have to pretty much figure out. Now depending on where you live, obviously, it's a lot harder to open up your own practice. It's harder just because you have to get all of the patients to come to you, obviously. So if you are going to be doing your own practice, it's better to always buy an old practice that they already have established patients. So when you're buying their business, you're also kind of buying their patients. That way you're not trying to, from the beginning, get patients to come in. You already have patients, so that helps a lot. And then you can obviously renew the office and change things the way you want it.
Thank you.
Yeah.
The next question I have on the list is there anything worrying about optometry as a career that you wish you knew about before choosing this path?
So in LA area, again, it's a lot more impacted. So as far as like jobs go, there's a lot of jobs. It's just in LA, the pay of it, all of the places look at what people are offering and they try to cap it to a minimum. And what ruins the market us. So when you go to negotiate your pay, a lot of the offices kind of don't want to pay you what you should be getting paid, and instead they try to lowball you. So you, as a new graduate, you're going to be taken advantage a lot. You guys need to stand up for yourselves and make sure you do good in that part, because everyone's going to try to lowball you. So you need to stand up for yourself. So I wish it's something they kind of told us more. If you live a little bit, like if you move somewhere else where there aren't too many optometrists, then obviously your pay goes higher. So it's something you kind of have to fight for as an optometrist.
Thank you. Next one is it's like two-part question. So I was gonna ask, how is your work-life balance? How is your work-life balance during school, and how is your work-life balance now? And like, do you ever get bored, or does it get repetitive for you?
Okay. So during school, I definitely did not have any time to work. I know everyone's situation is different. Some people do have to work, they have families, things like that. I completely was just focused on school the whole time. One thing I recommend, make time for a small hobby you have while you're in school, something that doesn't take up too much time, but it kind of gives you a break from studying. What I would do is every Friday night, if we didn't have like big exams, I would take the night off and do something like with a friend, family, things like that. I would take a break. And then another thing that helped during school is my roommate and I, we would take like half an hour to 45 minutes and go to the gym. And just that would completely change our mood and keep us kind of more motivated. So don't just continuously study, and then like it after a while it gets depressing. So you need to kind of form little things you enjoy. Or we would even go study at different coffee shops for a change of environment. So try to kind of find little things that help you. And then as far as work-life balance, so it's a lot easier once you are done with school. I have much more time now. Again, it depends what type of setting you work in and your hours. So my hours right now are from 10 a.m. usually to about 6:37 p.m., which it's a little long, but from the other end, I like to sleep in a little, so it helps me there. So if you're not a morning person, look at that too. And then work-life balance, just you learn to kind of adjust to everything. After a while, everything does get repetitive. So that's why for me, I like to focus on some like creative things just because that's a part of my personality. So definitely like don't forget about your hobbies and things you enjoy. Pick up all of those things once you're done with school. It's so important.
Thank you. Next one is, what extracurriculars did you take, or what do you recommend for undergraduate students?
So extracurriculars, one thing when you go for your interviews, they want to see that you have a personality, and they're looking for maturity. So don't be afraid to kind of talk about a hobby you've had or some type of activity. Like I used to be a part of a dance team, so that to me was very important. So in the interviews or while I was applying, I made sure to mention that. But don't just say that you did that. What's the point of that? The whole point is it teaches you certain things. So it taught me to be like motivated. I was committed to a team or something. So you want to make sure you show all of the things you actually learned from whatever you did. Don't just say I did this. Um, and then I did volunteering, like I said, in a hospital setting. So one thing they're trying to look for is how serious you are about that exact field that you're choosing. So they want to make sure you didn't pick this because, let's say, you didn't get into medical school or dental school and this is your last resort. They want to make sure you pick that field because that is what you want to do. So whenever you are interviewing, applying, make it obvious that, let's say you did volunteer with a dentist's office and a optometry office and you decided dental is not for you. You liked optometry. So it's things like that you want to mention. And then again, like a hospital setting, that wasn't for me. I did it for a year and I didn't like it. So you kind of have to test out all of those to see what you like.
Is there any programs that you didn't know about during your undergrad, but you found out later on that you would recommend for people to be a part of or volunteer for?
Let me try to remember the name of the one for the hospital I did. If it comes to me, I'll tell you guys. But honestly, I got into it very late. Like I said, it was my senior year that I started like looking into it a lot more, which I shouldn't have waited that long. But again, I never had like a mentor or anyone to kind of guide me. So it's just me figuring it out. I just did a lot of research after graduating, and then I'm not sure if you guys have heard of it's called Unite for Sight. That's the place I use to volunteer. So they have a few different sites. I'm not sure how it is right now because of COVID. You obviously can't get up and travel too easily, but I would look into that. If you feel like you can handle it, you pretty much go alone. I had to raise money here to help out with surgeries over there in India. And then you take all of these courses here. It's like just little tutorials you do, and it just prepares you for like a lifestyle that's different than what you're used to. So you don't go over there and be like in shock, because it's a lot more like a poverty area. And then I also had to like collect glasses here. So I had to take a whole suitcase full of glasses over there because people don't have it. So I literally went around to different offices. I didn't even know the doctors. I asked if I could use their machines to measure the glasses prescriptions, because over there, when you're in an area where they don't have anything, you can't just give glasses to anyone. So we had to know what measurements they had. So I literally had noted it on each pair. I collected about 700-ish glasses, and then took it with me, and it was just very rewarding. Like over there, it helped people so much. They literally could not see without it, and it was so hard for them to even like see a doctor. And then pretty much you go alone on that trip, so you have to be prepared in that sense. It's very different being alone somewhere. And then other people volunteer from different parts of the world, and by chance there was one other girl that ended up coming on that trip. She was from Australia, so that actually really helped me. I had a friend to kind of lean towards. So yeah, I would look into that. They have a few different sites, and it was a very safe program. I stayed with the doctor's family, so they had a like room they gave me. But the expense of it's all on you, so it's something you have to kind of think about. There's other volunteering things you guys can look into too. So I would definitely do more research. Just make sure it's a safe program. If it requires traveling, make sure it's like well known and very safe.
Thank you. That's very cool. Before applying, what do you recommend we do to stand out as an applicant, and how much shadowing should we do?
So shadowing, you guys don't have to go crazy with it. Just again, show that you shadowed in different types of settings. That way they know that that's why you're choosing the field you are, and that way you'll make a better decision for yourself. To stand out, like I said, it's more your personality, your hobbies. They don't just want to see that, okay, you went and got your A's or B's, that's okay too, and like that's it, that's all they're looking for. No, so it's like a combination of things. So like I said, it's more maturity when you're applying and going for your interviews. It's your personality mainly, and then when you are applying, it's how you kind of word things and show them like the things that you did do. Let's say you volunteered or worked at a place, things like that. You kind of have to tell them why that was important. Don't just list, I did this, this, this. You have to tell them the why. What did you get out of it? What was the point of it? So that's mainly what they're looking for.
Thank you. Next question I have in the chat is, um, what do you think are the main qualities that an optometry student would have to succeed in their career? And where do you see optometry going in the upcoming years?
Main qualities, you obviously have to be a little bit of a people person. So you have to like talking to people, which you'll get a lot of practice. One thing I liked about Western's program, starting first year, they start having you interact with patients. So you actually start seeing patients your first year. Within like 2 months of starting school, you're already seeing patients. So that's what I like. So you get your feet wet very early on. And then in your fourth year is when you completely only see patients. So you don't have classes anymore. It's your rotations. So in that sense, you'll definitely get a lot of experience there. What was the other part of the question?
Where do you see optometry going in the upcoming years?
I feel like, I mean, technology is improving a lot more. They're starting to come up with a lot newer surgeries now. Like if someone doesn't want to use glasses or contacts, they're coming up with a lot more than just LASIK. So I'm not sure if you guys know, I'm sure you've heard your grandparents of getting cataract surgeries. So a cataract makes it a lot foggier to see. So as we get older, eventually everyone gets cataracts. So now they actually have a surgery where you don't have to wait until you have cataracts. They clean out your lens and they insert a completely new implant lens. And then that pretty much has your prescription in it. So it's kind of like glasses in your eye. So far that's where they've gotten to. I'm sure by the time you guys finish, there's going to be so much more. Yeah.
Wow. Okay. Thank you. And what are some common challenges you experience as an optometrist?
Challenge. I just feel like anywhere you work, people are going to not take advantage of you, but they're gonna obviously try to have you work as much as possible, right? So at some point, like I said, as a new graduate especially, you guys definitely need to stand up for yourselves. So make sure whatever effort you're putting, whatever you're doing for that office, it's being, you're being paid for it pretty much. You're being acknowledged for it. So all of us have rights. We're all human. We have things to do besides work. So it's very, very important to just make sure you stand up for yourself. Yeah.
Thank you. Another question I see over here. Sarah had a question on your India mission. She said, "Is it something it's something I really want to do at least once in my life, especially with eye care. What organization did you go with?"
So it was called Unite for Sight. If you search it, it'll definitely come up. It's a very well-known program. Like I said, they have a few different like places you can go do it in. I just chose India because it was the most interesting for me. And then they pretty much, like I said, you stay with the doctor's family, and then every day we would like drive out to different areas that would need help, and then we would help out there. So you get your feet wet even though you don't know what you're doing at that point. But they do teach you, and then we got to watch a lot of surgeries. So one of the surgeries I got to watch, I was very close to the patient, pretty much this was the patient, this was me. And she, unfortunately, she was a young female. She had cancer in the eye. So they had to remove the whole eyeball. And while watching the surgery, since I was that close, I ended up getting a bit woozy. So it was a pretty funny experience for me. I started seeing like little stars blacking out all of a sudden. And then they took me out of the room, and I was fine after that. But that was such a cool case to be able to see. After that, um, they actually took us to a hospital too, and I got to see a hip surgery there, like right from, again, very close. Second time around, I was fine. That didn't happen to me, but same thing happened to the girl I was with. So that time it was her turn. She got a bit woozy. So that was a really cool experience. And then I also worked at a ophthalmologist's office, so I ended up going and watching his surgeries sometimes. So that gave me a good idea of like the surgical side of it, which as an optometrist, you don't do the surgeries, but you end up referring patients out. So you need to know what's out there and how it's done to explain it to patients. And then one more quick thing. So in India, they not only do you get to do the volunteering, they actually take you around too. So like they would give us like a few hours where we would have a driver and he would take us to like somewhere that was sightseeing and things like that. So I was there for about 15 days. You get to choose how long you want to be there. 15 days is definitely long when you're over there. Don't think it's not. Don't go, you know yourself better, but don't go crazy and go for like months, because it's very different than what you're used to here, obviously.
Thank you. Next question I have is, which year of optometry school would you say was the most difficult and why?
I would say third year was the hardest year, just because not only are you juggling classes and lab, by lab, we're pretty much practicing on each other, all of the techniques that we learn and use like during work. So you're balancing all of that. You're balancing twice a week we would have to go to like a clinic to get our patient like experience. So we'd be seeing patients twice a week. And then on top of that, halfway through third year is when you take boards. So you have to start not only studying for your regular classes, but also for boards. So it's a lot to juggle. Definitely that's when you have to like focus the most. And then from there on, for optometry, boards is 3 parts. So that first part's the hardest one. And then the second and third part, you pretty much take a little later on. So you take the second and third one in your 4th year while you're on rotations. So that's definitely the hardest one.
Thank you. And do you feel like there was a harsh adjustment period from undergrad to optometry school? Did you have to switch your studying methods?
I feel like by the end of senior year in undergrad, you kind of get an idea of how you study best. So definitely take that with you to optometry school. Personally, I can't study with a lot of people, like with groups. I'm very good with one person. So me and my roommate, we actually worked really well together. So I'm more of I explain things out loud person. So I would do that to her, and then she would learn from hearing someone. So it worked out perfectly. I'm also very, like, I like making diagrams and getting the whole picture. So I would do all of that. Just don't get tricked into spending so much time where you're making all these things, but don't actually have the time to learn it. So don't go sitting there highlighting it in different colors. And also you want to just, you have to learn what works for you, but be quick at how to kind of study for that.
So with that being said, how did you study for the OAT, or what resources did you use?
The OAT, like I said, I took that 1.5 years off because when I study, I don't like being rushed, or I don't like doing a million other things if I'm studying for a really big exam. So I took about 2.5 months to study for the OAT. I used, have you guys heard of the Destroyer? That's what it's called. So I can message it to Vacha later so he can send it to you guys if so in case you forget the name. But it's called the Destroyer. It goes over everything, so I would definitely use those books. And then towards the end, when you're about to like a week and a half before the actual exam you're gonna do, start doing the practice tests. And then I actually ended up getting books, the Kaplan books from the libraries. So the MCAT ones and the DAT ones, the dental ones. And I used the practice tests at the end of those two to just time myself and just get used to doing the long test. And those helped a lot. So I definitely recommend that last week and a half to do the practice tests a lot.
Thank you.
And sorry, one more thing. For the OAT, as far as scores go, focus on your weakest subject. For example, mine was physics. So spend a little extra time studying for that and making sure you can score at least like, you don't have to score amazing, but at least okay. What they look for, pretty much how you end up passing. It's not good to be very good in one subject and then do really bad in the other one. They kind of, you end up passing if you're like average in all of them. Okay, so whatever your weakest subject is, work on that a little more so you bring that up a little more so there isn't like a big gap between your best subject and your weakest one.
Nelly mentioned, do you know if the Kaplan OAT prep course is effective for the OAT prep?
Yes, that definitely helps. I didn't take any, like I didn't pay for like courses like that. I never ended up doing it because I can get myself to sit down and study. So like I said, that 2.5 months, I was like, I'm studying every day from this time to this time for this. So if you can do that, do that. But still get the books for it and stuff. You can use it to prep yourself. But if you're not a person like that, you need more direction, then definitely sign up for those courses because they really help.
Thank you. Next question I had was, what did you major in college? And is there a specific major that you recommend students should do in order to have a better background in optometry?
So honestly, in optometry school, it's more focused on like so there's math involved and then there's the eye related stuff and then systemically. So you don't have to take courses in undergrad. Just I ended up majoring in human biology because that's what I loved out of everything. But you don't have to do like a bio major. You can completely major in something else. You just have to make sure you do the prerequisite courses to get into optometry school. And those prerequisite courses are pretty much what prepare you for the field. But it's not like you're going to be sitting there and it's not like those undergrad courses. It's more focused on eye related things in optometry school.
Someone said, what are your thoughts on majoring in something other than common majors like biochem, which you kind of discussed? For example, majoring in business or sociology. Do you think it's worth the class? Do you think it's worth the class required for the major plus the prereqs for optometry?
So if it's not making your whole like undergrad journey too much longer by majoring in something else and then on top of it doing the prerequisite courses, then definitely do that. If it's, in my opinion, if it's making your whole thing undergrad longer, then I don't think it's worth it unless you absolutely love the field and you want to learn about it. But you're definitely, they like seeing the difference in, like, you don't have to major in biology, let's say. That's the common one.
Thank you. And then Nelly asked, when is the ideal time to be applying to optometry schools? And when is it considered late in the cycle to apply?
So ideally, right when the cycle opens, your chances of getting in are definitely a lot more. Because it's they pretty much take patient. I'm used to saying patient. They take students a lot more like during the when it first opens. But like my roommate, she actually ended up applying towards the end of the cycle and she found out she got in and a month later she started school. So she did it by chance and it worked out for her. I ended up applying right when the cycle opened, like a month into it. And then by September, I remember I had gotten interview dates. And as far as interviews go, another piece of advice I have for you, try to pick your most top favorite school. And what I did is I set that one up first, and then I set up like my backup schools interviews afterwards. That way, as soon as I found out I got into Western, which was my top choice, I canceled the other ones. It's just honestly like a more of an expense to some people like just flying out to the schools and doing different interviews in different states. I know people who did that too. If you like it, go for it. But to me, it was like an extra cost for no reason. I already knew I wanted to go to Western. So I canceled the other ones and just went for it.
There's two follow-up questions to the last question. It says, what are other optometry schools did you apply to, and how did you prepare for interviews? Any books or services you used? Question.
So I actually ended up applying to 5 or 6 different schools. The more you're applying to, you have to obviously pay more for the application. A lot of people I talked to said to not don't apply to like a million of them. It's not necessary. So apply to like the places you really think you're gonna move to. You realistically would move to. Apply to only those. I had applied to Florida's school, New York SUNY, Berkeley, and then the Orange County one, and then Western. So those were the 5 I did. And I ended up getting interviews for all of them, but then I canceled the other ones.
Perfect.
And as
Thanks.
far as the other part of the question, so preparing for interviews, definitely practice. I remember when I went on my interview, a guy showed up. It was very obvious he hadn't prepared. He had that type of personality where he just like went with the flow, and it was very obvious. And you can tell like when they're interviewing that they don't like that. It just shows you're not serious. So definitely prepare. I'm not sure if you guys have seen, I have a website. I help students prepare for like applying to schools and preparing for interviews. I'll send that to Vacha again. You guys can, or message me if you want. But definitely practice. It makes a big difference. I didn't use any services. I just practiced on my own. And the reason I ended up making my website to help students was again because going through all of that, I hated not having someone to talk to. I didn't have an older cousin that or sister or brother that went to any of that type of school. So I didn't really have anyone to ask questions to or talk to. So that's why I ended up after graduating making that.
There's a few more questions. Before I move on, all of those resources or links Dr. Honarchian sends me, there's a link that Sophia sent in the chat. If you guys want to join that, I will send any resources or future events that we're going to have in the group chat over there. And then we can continue on with the next question. In terms of ROI, do you think the loan versus the pay ratio is worth it?
So for optometry, again, it depends what your situation is. Definitely my biggest advice is don't take out extra loans if you don't need it. um, uh, if you guys remember when you're applying for loans, they kind of give you estimates of every section, like how much they think books will cost you, how much they think all of like those extra things will cost you. I've always ignored those parts. Everything is all through your laptop now, your lectures, everything. You might have to buy a few books here and there, but it's not like you're spending that chunk amount that they always list there. So I always like ignored that part. Try to calculate your cost of living. So what I did was I didn't live on campus. I lived like 2, 3 minutes away from school in a community, like a gated community, in a really big condo. And we had like a few roommates that went to the same school. And because of that, the rent was a lot cheaper. So it was literally half the cost. So definitely look into that instead of staying right on campus. Try to join like Facebook groups of students that are going to be in your class once you get in. And then from there, just message people, see who needs a roommate, and then you guys can start like looking into like living around the area. Just make sure it's like a safe community depending on where the school is. And then based off of all that, pick the amount of loans you're gonna take out. Don't just take everything they're offering you. That's where people get tricked. Don't go on shopping sprees with the loans. Yeah. And then as far as the pay goes, again, it depends what type of setting you're in and where you live. Like the pay is, don't get me wrong, the pay is very good for optometrists. It's a comfortable life you're gonna have. You do have to work obviously, but it's not, at a certain point, if you don't have your own practice, the pay of it gets capped. There isn't too much room to grow. That's the only thing I don't like about it. So definitely, obviously, owning your own business is going to make a big difference in your pay.
Thank you. Alex asked, why not ophthalmologist? And can you perform surgeries as an optometrist?
So you can't do surgeries as an optometrist. There's, I think, two or three states that allow optometrists to do LASIK. That's about it. I didn't go into ophthalmology just because I'm very big on family and I want to have a big family myself. So as a girl, I had to think about all of that. So if I did ophthalmology, I would have to go into medical school, and that's gonna add another 3 to 4 years extra to schooling before I can even start working. So that was definitely something I didn't want to put the time into doing that. So optometry in that way, you actually get to have a life and the career that you like. That's what I really liked from it. So I chose optometry. And you still see, it's not, there's a big misconception. People think it's just giving glasses and contacts, but you actually see a lot of really cool cases, like health wise and disease wise. A lot of things we pick up from the eyes. So it's not like you're just sitting there doing glasses. It's a lot of that too, don't get me wrong, but you also get the other side of it too. So it's best of both worlds.
I don't see any more questions in the chat. Is there any more questions that anyone has?
You guys, if you can't think of anything right now, honestly, feel free to message me. Like if you think of anything, I'm very open to helping you guys out.
Andrea mentioned, does California have a broad scope of practice? I know they said New York is bad with just now passing oral meds.
California is actually really good about that. So yeah, we can prescribe oral medication. A lot of states don't allow it. Yeah, most of the things California is very good with it. So you guys are fine there. You can treat glaucoma, you can prescribe pretty much medication, things like that. Now they actually passed us giving vaccines to patients, which I don't think is I don't think it's necessary, but they passed that too. So
I see one more question. It says, Nelly said, when does the application cycle begin?
I believe it starts in July. So I don't know the exact dates. It's different every year. I can definitely look into it for you if you want, but it's through Optomcast. So if you search that, it should tell you when it opens up. And then plan to spend at least like 3 to 4 weeks working on your actual personal statements when you're applying. It's not just like a one-day thing. You're not going to just apply that day. So plan 3 to 4 weeks of once you sign up for it of working on all of the things before you submit your application.
And there was one more question. Do you need to have your OAT score before you apply? And do you need, how many letters of rec do you need?
So OAT scores, you don't need to have them. You can kind of put it in the application that you're the date you plan on taking it, and then you submit it to them afterwards. Good thing with OAT is you get your results right after you take it, so you don't have to wait. And then you submit it to Optomcast, and then based off of that, they might contact you for interviews after. If you can, try to take the OAT before, so everything's just done, so you kind of get your answer. That way it doesn't prolong it. If not, it's fine too. I know a lot of people who applied and then took their OAT.
And then Sophia also said, do you have any advice on letters of rec?
Letters of rec, I think you can submit up to 3 letters of rec or 4. It might be different now. I applied a while ago, but letters of rec definitely, it doesn't only have to be from doctors, so it can be from a place you've worked that they know you well. Just make sure you trust the person and make sure you have a good relationship with the person, so that like 100% you know that they're gonna write something good about you. And then if you guys need letter of recs too, feel free to reach out to me, and I can help you with that too.
Nelly said, I'm a transfer student. Can I ask letters of rec from professors at my community college?
Definitely. So that's what I actually ended up doing. So I got a professor to write one for me. I got my boss, the ophthalmologist, to write one for me. And then honestly, anyone you've kind of worked with that knows you. And then if you've been a part of a team or something where you can get someone to write a letter of rec about that too. But just make sure that they're talking about the skills you have and things like that. With letters of rec, they don't show you, the person who writes it doesn't actually show you what they write. So you have to make sure you trust that person, that they write the right things about you.
Yeah, usually for letters of rec, they, at least for now, I think they require one optometrist or an ophthalmologist, a professor, and an employer or somewhere you volunteer that can trust. So it's, I think, 3 minimum. So I know that was like one question Nelly had. Another question was, were there any Canadian students in your class?
Oh yeah, we actually had about probably 9 Canadian students. So that was a big part of our class. My class was a big one. It was about 93 people. By the end of 4th year, I think we were left with like 78 people. So some people had to take another year, or like repeat a year, or like some people it wasn't for them, they dropped out. But a lot of Canadians.
And Alex also have one question. What are some differences you can list between an ophthalmologist and an optometrist besides surgery, and the pros and cons?
With ophthalmology, it's like I said, a lot more fast paced. So they see a lot more patients, and that's because they have so many more techs that do a lot of the things, and then they just see the patient literally for 2-3 minutes. As an optometrist, you're going to spend a bit more time with the patients. I personally like that more. And then differences, I feel like the other one, you're ophthalmologist, you're more on call, especially if you're new. But because you have to go through medical school and all of that. But with optometry, you're not on call, which again, I like that because I have a life outside of work, so it helps. But ophthalmology, you're obviously going to get paid a lot more. So you have to sacrifice something.
Sarah said, so we don't see the letters of rec. Do they just go straight to the?
Yeah, so the way it works, you write the person's email, and then through Optomcast, they send it. The person who's writing the letter of rec will get an email, and then they fill the form out there, and it goes directly back to Optomcast. So you never actually get to read the letter.
Okay. So we have a couple of more minutes. If you guys didn't ask your questions today, I'm also gonna drop Dr. Honarchian's Instagram in the messages. You guys can follow her. She always does on her stories like Q&A, so you can type. And she always shares special stories about different patients she's had that day. So it's interesting. You can always keep up with her. I'm gonna just put that right there. And again, yeah, if you guys haven't joined the group chat, I would highly recommend you join for more events and resources. Does anyone have any last minute questions that they would like to ask? In your honest opinion, is optometry school an obtainable goal for almost anyone?
Yeah, I mean, if you go through undergraduate school and like volunteer a little bit, you'll kind of know if it's something for you or not. It's definitely obtainable. You just have to like kind of commit yourself to studying for those, let's say, 4 years. You have to really commit to it. You can still have a life on the side, but you have to definitely commit to it. It's definitely obtainable. If I did it, you guys can all do it.
Perfect. Thank you. Any more last questions? Okay, with that being said, we're just gonna finish it up. I want to say thank you to Dr. Honarchian for joining us today.
For having me, guys.
Yeah, I really appreciate you coming and talking. I think you answered a lot of questions. So yeah, we're done.
Okay, very nice
Thank
meeting
you.
you all. Thank you for having me.
Thank you so much.
Thank you, Dr. Honarchian.
Good luck.
And just a quick update, this video is recorded and it'll be put up on our YouTube page probably in a week or so if anyone needs to like see something again.
Thank you. Anyone has any questions for us? No.
I think we're all good.
Perfect.